So if you must take pain relief for a long period of time, tell your pharmacist or the doctor. I know they know what to do, but because you have come across my video, you will help them to attend to you better. So they should add a drug. We classify those drugs as PPI, that is proton pump inhibitors. I'm not going to explain the mechanism of action of those drugs in this video. Maybe in my next video or my students, I will teach them, I will explain to them. So if you must take pain relief for a long period of time, you need PPI, example omeprazole, rambeprazole, esomeprazole, all those are PPI. So you take it alongside your pain relief. You understand? And there is another group of drug called selective COX-2 inhibitors. Example of it is celecoxib. Now, how does this class of drug work? Now, remember I told you the NSAID block COX-1 and COX-2. And COX-1 is responsible for production of prostaglandin that protects the inner line of the stomach. But this COX-2, selective COX-2 inhibitor, celecoxib, they only block COX-2, that is cyclose oxygenase 2, without blocking COX-1. That is to say, they will only block the prostaglandin, production of prostaglandin that transmits pain to the brain without affecting the prostaglandin that protects the inner line of the stomach. So those are the kind of drug you should take, especially if you already have an ulcer. If you have been diagnosed of peptic ulcer, you should go for celecoxib, or you can take mucosa protective agents, misoprostol and diclofenac. I know most of you already know what misoprostol does, but that is not what it meant for, and I'm not here for that. I'm not here for misoprostol, but combination of misoprostol and diclofenac can actually prevent you from having stomach ulcer. And those who already have stomach ulcer can as well take them to relieve their pain, aside the celecoxib I mentioned. But there's one thing about celecoxib, and that is why I'm here. I'm a pharmacist. When it comes to drugs, I know better. Okay, so celecoxib is not to be taken if you have a cardiac or any heart issue, because that is the major side effect of that drug. It causes cardiac disease, heart disease. So if you already have heart disease, you are hypertensive, you don't need to take celecoxib because it will worsen your case. See you in my next video. But don't just watch without liking, without commenting, and without sharing.